My name is James Milne. I'm a consultant dermatologist. I work in Gloucestershire in the United Kingdom, but I'm originally from South Africa, which is where I trained at Groote in Cape Town. I mean, I've been in the UK now for 12 years, so I haven't been in South Africa for a while. So I've mainly looked after people in the southwest of England, where there is a bit more sunshine than the rest of the United Kingdom. My population is an elderly population, and they do have quite a lot of sun damage. So skin cancer, particularly in the southwest of the United Kingdom, is a problem, and obviously pre-cancer and is an issue in the elderly population. So it's something that I deal with a lot. The United Kingdom is good at focusing on education and awareness, but there are an awful lot of people who just don't care or who are not aware of the problem. It depends on, I guess, sometimes a level of socioeconomic status in terms of education. It depends on whether their GPs focus on that particular issue. Unfortunately, skin is not a high focus area, for instance, like breast cancer and other cancers. So some GPs, it's not high on their agenda in terms of educating their patients with regards to skin cancer and pre-cancer. But overall, I think that the UK is good at general education about sun awareness and skin cancer. I think for the general population, often they are confused about what is cancerous and what is non-cancerous. I think we focus on the message that if things are changing on the skin, they need to be checked, because it's difficult to educate people about exactly which lesion is cancerous or non-cancerous. And the message is really that if something's changing, they should get a doctor to look. Well, I think anything that doesn't look right on the skin or changes should be checked by their primary care physician, and hopefully their primary care physician will then refer that patient if they're worried about skin cancer, or treat appropriately if they have enough knowledge about pre-cancer and cancer. Well, I think you have to divide skin cancer into melanoma and non-melanoma skin cancer. If I focus on non-melanoma skin cancer, the predominant risk factors are sun exposure, and particularly the amount of sun exposure you have when you have it, particularly as a child. That is dangerous. And if you have intermittent sunburn and you have fair skin and you have a family history of skin cancer, those would be the worrying factors. For melanoma skin cancer, again, it's more intermittent sunburn, particularly as young people, and the number of moles that you have on your skin. So if you have a lot of moles, you may be higher risk for melanoma skin cancer. Most people don't prepare when they come. Some people do. It's always useful to know about family history of skin cancer. It's useful to know about their sun exposure and whether they've used sunbeds. And also it's useful that they've examined their skin before they come, so they know about the kinds of things they want us to actually look at. It's amazing how many people have no awareness of what is on their skin, and they just referred by their GP about a individual lesion, and when asked about that lesion, they have no idea how long it's been there, whether it's changed. So it is useful sometimes that people are aware of what is on their skin and what is changing, but for the majority of people that come, I think they haven't presented. It's something that the GP has recognized and has referred the patient on. So yes, I guess it would be helpful to know a bit more about things that they have seen on their skin, and sometimes about whether they've changed or not. I think if we're looking at solar keratosis, which is a pre-cancerous lesion potentially, there are some that are very small and ill-defined that are less likely to turn into skin cancer, particularly squamous cell cancer, but some of them are raised and large and painful, and those would be the ones that would worry me particularly. And normally when I see somebody who has solar keratosis, which is a precancerous condition, I usually say to them, if they become painful, if they bleed, or if they're growing, then they should present to their GP or come back to me. That would be the kind of thing that would make me worried. It's easy with the people who are educated and worried and examine themselves, that they will present and they will usually see things changing early. It's the people that don't really care or have no access to medical health. How do we get those people to examine their skin and present earlier so that we can actually make a difference? And I guess it would be great if there was more money channeled into people being more interested in examining their skin. But I guess I just see skin because that's what I do, and there's all sorts of different things that other people are doing that they feel are more interesting. So I don't know, it's a difficult one. Ultimately, what we're trying to do is save more lives from skin cancer, and that means primary prevention. So there's not enough focus on primary prevention, I feel. And a lot of the people that are coming to see me are people who know an enormous amount. Often the worried well, and they perhaps don't benefit from the consultations that I have with them, because actually they're doing all the things that I would be doing, keeping an eye on their skin. It's the people that don't look at their skin that we're more interested in.